DNA to advocate for the rights of people with disabilities. We at DRC are entrusted to defend, advance, and strengthen the rights and opportunities of people living with disabilities. We do this work through litigation, legal representation, advocacy services, investigations, public policy. We provide information, advice, referral, and community outreach. That's just a little bit about us at DRC. And I say this because it brings us great joy to introduce to you Susan Gallagher. And it makes me cry because Susan has been such a staunch advocate for so many years. Susan has been the executive director of Cal Voices, the oldest peer-run advocacy organization in California, for over 27 years. She has been the driving force behind the growth and development, transforming the agency into a statewide peer-run organization. Susan's own personal lived experience with the mental health disability undergirds the program development and strategic implementation of the agency's core mission and vision. Susan has led the agency from a small, local, peer-led nonprofit to a dynamic, fiscally sound nonprofit with an annual budget of nearly $5 million. Susan has demonstrated proven success implementing both small and large-scale peer programming projects. I had the great pleasure of meeting Susan through my mentor, Tina Wooten, who's no longer with us. But I'm beyond grateful, Susan, for the work that you have done through Cal Voices, unapologetically. And as I, pass it over to you to say a few comments, Susan and I, in this moment, stand in solidarity with so many of our peers across the state. We are just bringing this conversation forth, hoping that many others will be inspired to develop and create community conversations across the state. So Susan, I turn it over to you.
Thank you so much, Vanessa, for that great introduction. I hope I live up to it. I'm just really delighted to be here, to be talking to our community about really some of the impacts that many, many things are having on us right now. But honestly, like the title says, to really reclaim our leadership around these kind of issues and what is happening in our behavioral health system, and really to kind of reinvigorate the voices that so long have been silenced and marginalized and that we have not had the opportunity to hear from. And so, as Vanessa said, today is really just the start of these conversations. um, it's my first time on Restream, so bear with me, but it's very, very exciting. I'm very happy to be here. Really grateful for DRC's work around this and bringing us together, and happy to be part of this conversation.
Thank you so much, Susan. Next slide, please. I'm not sure if the slide has moved to the next one. And if there might be a little bit of a lag, so I'll pull it up on my end just to keep the flow going. So comms team, I am looking at the second slide now. So the purpose for today's conversation is to prioritize community investment and peer support, to advocate for non-carceral mental health systems, urgently address restrictive settings and Olmstead Act violations, improve California's mental health approach, avoiding inhumane solutions. Next slide. California must do better. And that's what this conversation is really about, right? You must do better. And what does better look like? Susan, I know that you've talked about, and next slide. I know that you've talked about, meaningfully engaging our people. And I know that you've shared that the state has failed to meaningfully engage our people. I know that's not something that you have just said, just by yourself, right? This is something that the peer community has said for a long time, right? We know that there's also the recovery community. So people not only with diagnoses that fall under mental health disabilities, right? But we know that people can and do recover, and we're living proof of that. Um, Next slide, please.
Did you?
Yeah, well, Susan, I just wanted to, these are some of the recommendations that I know that you've shared. And if possible, with the last slide and with this slide, will you share a little bit about meaningfully engaging our people and what does that mean?
Sure. Thank you so much for asking. And I think it really sort of comes to light in with the recent developments that have happened in behavioral health, especially things like Care Court, SB 43, and most recently Prop 1. Um, I feel, and I think most of us in the mental health community and the behavioral health community as well, the substance use folks as well, that we have been left out of these really important dialogues that drive policy and program development at our state level and then ultimately at our county levels. And, that's really been proven by these recent developments because the client voice has really been left out of those conversations. Nobody has come to clients and said, what do you think about SB 43? Nobody came to the community and asked what we felt about Care Court. And really, nobody came and asked us what we thought about Prop 1 either. And so, as the oldest peer run organization in California that represents so many interests and intersecting identities and so many people who have received services in our behavioral health system and our substance use AOD side of the house, we have been working and collaborating and serving and advocating for these folks forever. And so to be left out of these conversations has been really a huge omission and feels like the civil rights of our community has really been on the chopping block. And we see that really very clearly as we, you know, um, read DRC's most recent report, Stuck in LA, and we see that so many people are being locked into facilities for much longer than they need to, that medical doctors are saying they can be released, but they're not being released. We have people sitting in our jails in California, not just in LA, and not just in LA in the hospitals as well, but in many other counties across our state that are sort of stuck in this logjam. But it's not just sort of like waiting for services, it's their rights are being violated. Their civil rights are being completely violated. We are breaking the Constitution. And I don't know how we can not draw more light upon this situation. I feel like if this was any other marginalized community, if this was any other community, that these things wouldn't be allowed to keep happening. But they keep happening because somehow people think that we don't know what we need and that the government knows better than us. And so, our approach is really to be moving away from these systems. But the only way that we can do that is if we empower the voices of our community to be stronger, to coalesce, and to come together around these things. And, kind of the ship has sailed with a lot of these things, but we want to build upon this time and this movement and really bring people together so that we can really bring your voices forth in many, many different ways and to build a framework for that. And we really hope that the state would recognize that and welcome it. We feel like it's long past overdue. And I think it's extremely important to hear from the actual stakeholders, the primary stakeholders, people who have lived with behavioral health disorders, who have been unhoused, who have attempted suicide or have suicide ideation, people that have been incarcerated, people that have been incarcerated and not even been brought charges against. I mean, this is what is happening to our community, and we really need to build up our movement and to be much more vocal in our program and policy development. And how we do that, it's really, I mean, you guys know better than us. And so we want to listen to our community. Today isn't exactly interactive, but you can put questions and comments in the chat boxes. We will be responding to those as much as we possibly can. And we really want this to just be the beginning of these conversations that are so, so important.
Thank you for that, Susan. And as you share that, one of the things that comes to mind is we the people, right? And we are the people, right? We are the people that understand what these processes are like, and most importantly, how we recover. And I say this to also uplift the use of things like psychedelics, the use of things like cannabis, right? Plant medicines that have helped our community heal in many ways. And of course, I'm not encouraging everyone to like jump off the call and smoke a fat doobie or nothing, But what I'm saying is that oftentimes when we share what works, that is not followed up with the appropriate funding
Right.
that is needed, right? Because, like you said, oftentimes the government operates in a manner where they know what's best, and then they highlight some of our community members that are in that need the highest level of care because they've been failed by these systems that generate harm and violence through not funding what we say works. And although you and I have both navigated so many of the marginalizations or the marginalized communities that you mentioned, we oftentimes get viewed as, well, we're not talking about Vanessa and Susan because you all are too well, right? And it's like, that's not true. Like, that, yes, right now I am, but if you take away my job, if you take away my house, if you take away my access to treatment in a way that I find helpful, right? Mutual aid groups, 12-step groups, right? Like, then I'm not going to be able, right, to ever showcase that we do recover. And you will continue to point at our siblings who are on the street as reasons that we need more forced care when we know that what has worked has never really been funded. Next slide, because I mean, I'm sure we could go.
I think, as you
Yeah.
say, some of the things that come up to me is like, look at the housing. They really wanted to take our MHSA and use it towards housing, which it did pass, albeit very, very, by very, very, very slim margin, right? Um, but they've already spent $24 billion on housing, and we don't even have any outcomes to show for it. So clearly the state has not been very good stewards of the housing funds, and we don't know how that's being used. And now they're going to take our MHSA funds and also use that towards housing. So just keep adding to the 24 billion that has no outcomes and no kind of effectiveness or no measuring. It's troublesome. And I guess for me, I've been doing this work for 27 years and, running peer support, direct peer support programs, working on collaborative teams with the county, mobile crisis units, standalone wellness centers. And I don't ever see the full throttled funding come for those type of services. I've never in 27 years. I feel like we've had to scratch and claw off every single bit, a piece of the pie that we get, and that it's always been so difficult for peer run orgs to get any kind of funding or really be elevated in the way in which we should be to drive policy and to drive the kind of discussions that we're having. But we're very rarely put in those leadership positions to do that, and we have always had to fight for the smallest pieces of the pie. And we
While oversight and accountability commissions are created that are quite frankly laughable. I could do just an online chuckle. Ha ha, I don't know. It's like theater, right? Where we're no shade to those
it's
who
very little
truly,
accountability or
right.
oversight. Yeah.
Exactly. So, what I just want to put into context for those that may not understand what we're saying is that the state, people are taxed, tax dollars go up to the state. The state then distributes those tax dollars throughout the counties of California. The counties then entrust their departments of mental health departments to disperse those funds. Oftentimes, the contracting piece is very hard to access because organizations that are doing the work can't, it won't submit a grant proposal on time because maybe they don't have the bandwidth or the capacity to do so. Maybe they're not aligned yet with the ways that they need to in order to receive some of those funds. So there's a few orgs that do have access to those funds, but then such little money is given to these community-based organizations that it creates this pinning of org against org because everyone's competing for the same contracts that are run through a scarcity model. When we look at the checks and balances of what it costs to run institutes of mental disease, right? We know that the expense, the overhead to run these jail like quote unquote institutions or hospitals are not only extremely high, the outcomes lead to higher levels of recidivism.
Right.
And many of us have pointed to concerning patterns in unlocked institutes of mental disease that include safety violations, coercive practices, and much more. Next slide, please.
Yeah.
And
And
then,
I just
Susan, if you could speak to the recommendations.
oh, of course. And I just kind of wanted to talk a little bit about, sort of these unlocked IMDs. I guess that's sort of the new way to go for a lot of the substance use population. And of course, people need treatment. I'm not here to say that people don't ever need inpatient treatment, but the as much as we can do this on a voluntary basis, we should and we must. And I don't think that that's happening. I think people go to the hospital and then they're put on a hold, even if they are going voluntarily, all too often in California. And now it sort of seems like these big institutions that are like more for substance abuse, and they're supposedly unlocked, but we have to remember that they're still institutions. They're still not community-based settings that are home-like, that are in the community, that are and many of these have very coercive environments. Like if you don't do this, you won't get this. You and there are rules and there are some really heavy regulations of visitation and all of this. And it's not as if these people can come and go as they want.
And
It's not a freedom. It's not a, yeah, I can participate or not. You're coerced to participate or you won't be in the program. And so that is typically how these programs run. And so it's a very, very different approach than what we would want. It's not a progressive approach. It doesn't prioritize recovery. It is really treating us oftentimes like infants, very paternalistic, very patriarchal. I could throw a lot of other terms out there, but it's as if the government believes they must surveil us because they know what's best for us and they're going to help us whether we need it or not. And that is really flies in the face of everything that we learned about peer support in the recovery movement. What did peer support grew out of an anti-psychiatry revolution, basically, because we weren't getting our needs met by psychiatrists and we were being abused in places that were supposed to care for us. And so, the movement grew out of this, peer support grew out of this. And now everything is sort of very much seeming to be co-opted into a very institutionalized way of thinking, into institutionalized settings. And, we're even being told now, well, peers, you can work in these settings, and that is really kind of counterproductive as well, because we really should never be working in coercive settings because peer support should never be coercive. And I guess the thing I also want to say about any kind of coercive environment, coercion is force. And when you have people who have been traumatized, hurt, sexually assaulted, many of us have had these experiences which have kind of precipitated our mental illness, right? I know I can speak for myself that many of those things happened to me. I experienced domestic violence, experienced sexual assault. Many of these things are the things that created this trauma in me that I needed to overcome. But when we use coercion on people such as us, that is a punishment. It is punishment. Coercion is by its very nature a form of punishment. And so we are re-traumatizing people over and over again under the guise of this benevolent care. But we're not really giving the people the care that they want, that they need, and that they've asked for. And so I guess that's where we want this conversation to go before we see any more hindrances and more things coming out that violate our rights. I mean, I just can't even believe that we're here today after 27 years. It's like, how did this all happen? How did this all happen in the last few years where we've just completely rolled back civil rights in
And,
California, of all places?
and very boldly, I would like to share with all that the Olympics are coming to the US. The Olympics are coming to California, right? The history of the Olympics has a long line of banishment of disabled people, of poor people, because of the amount of people traveling from different countries that will come here to experience the Olympics. There's a lot of money behind that. Our governor, in many articles, has been, it's been shared that, the governor has abandoned California to seek presidency. And although people have the right to seek higher levels of office, it is inappropriate to abandon the state that they've been entrusted to lead and build out policies and solutions without including the people that have navigated these systems, right? And that's what you're pointing to, and the actual environment. For instance, if someone is living with cancer, or if somebody is receiving a medical intervention, they are not taken to a hospital that looks like a prison. They are given a fuzzy blanket, they are their phone, their shoelaces,
Yeah, their
right?
phone's not taken away, which
Their
is one of the
phones,
number one things, right?
right? But we
Nobody in a
know,
psychiatric hospital gets to keep their phone.
right? But we
In
know
any other
that
hospital, you can.
right. So we know that when people live with psychiatric disabilities and they are needing higher levels of care, the interventions that exist are placing them in literal settings that feel jail like, that are cold. I know when I was at the psych hospital, they would give me these silly slippers. I also live with also neurodivergent, so there's texture is important. So they would put me in these silly outfits that would really frustrate me. And because they weren't listening to what I was saying, I would constantly get into more trouble. If I was incarcerated, I'd end up in solitary confinement, right? Because there's very little thought being placed into what are accommodations for people living with psychiatric disability. Is not having access to the sun, does that hurt or harm?
And
If
we
we're
know that
medicated,
these people are being held in solitary. They are segregated from the population oftentimes, and so even more punitively on top of an already punitive system.
right? And it just goes on. So let's just go to the next slide, because I
Yeah, I
know,
did want to talk about
yeah,
just
for sure.
this gathering of the stakeholder groups. I mean, I feel like we need to build a framework for that. We really want to take the lead of the community on that instead of, sort of developing a framework and saying this is how it is. We want to hear from you. So, and I think that we need to not wait around for government to give us the pass. That here's some funding for us to form a stakeholder group. I don't think we can do that any longer because they're not really our allies at this point in time, or they may not be looking out for our best interests despite the benevolent framework that they want to talk about. Because these are harmful practices that they're putting into place, right? This is
Amen, Susan. And folks,
to
with
many of us, it's
human,
state violence, right? I mean, that's
yeah,
exactly what this is. And so, we can't rely on government to fund us. We have to begin to work together to do things amongst ourselves as a grassroots community and bringing these things to bear. Because even with the government contracts, oftentimes they will tell you, well, because of this funding, you can't say this. I mean, I've been hearing that for 27 years now, so I mean, I'm
you
still
keep
a big
saying
mouth.
it. Yeah. See,
Yeah,
and just so
God knows
all listening,
I've
so
suffered. Um, but and our agency has suffered sometimes because of those choices that we have made to be very vocal. But if we're going to be an advocacy agency, we need to advocate for the people, and I just have always felt very strongly that that is really our main focus. But we want to work together with you as our community and to create these forums for change and to gather voices and to really, kind of put forth a loud vocal consensus of people that can say these things are not okay and what does work, and here this is better, and that's why we really want to strengthen those patients' rights protections, particularly now that we're building more and more and more locked facilities. um, we ask when the government works with us that they will talk to us in a transparent fashion. Sometimes we're asked to come to the table, but we don't have all the facts. And I think we need to have as much facts as the people in power, right? Because this is all about the power. We need a power disruption is what we need, because if we can't share power, then we can't really make any change. And so we keep being invited to tables and sort of marginalized. They're going to tell us little bits of this and little bits of that, and then we never know enough to make really thoughtful decisions. And when you ask a lot of questions, they say, well, that's not about this. Oh no, we're not talking about that today. But it's all connected. And so we really ask that our state and local governments, when they work with us, that they will give us all the facts, that they will share all the data with us, that there will not be any secrets, because these are public systems, and literally the public systems are here to serve us. So we shouldn't always have to be asked for a place at the table. We shouldn't have to work our way to get a place at the table, and we shouldn't have to beg for the information. Information should be given freely, and not as a mean for co-optation or to manipulate, but to actually gather authentic, meaningful stakeholder involvement.
And this is a call for liberation. What I'm hearing you say, Susan, is enough already. Stop. Fucking
Eat
stop.
our own table.
Like we have the power. We have our God-given right? We have the power to get together and build out community input forums and then share that information directly with the states, directly with the board of supervisors, directly with these people. And if the county mental health systems want to do the same, guess what? We will share input, but our focus is not on making government any bigger, because when it comes to mental health, well, the only thing that gets bigger is the jails. Care court, SB 43 and Prop 1 are extremely concerning. Next slide, please.
I
And
mean, it's
as
almost
we
as if that's what our mental health system is going to be from now on. I mean, that's what it feels like, right?
no, and it
Community
is.
health system. That's not what the Bronze and McCorquodale Act had put forth, way back in the 70s when we were looking at building community. And I
Right.
still think that building community is the answer.
Well, it is, and that's why we're gathered here today. And to our state and federal partners who are on the call, we thank you for being here and for joining and for listening in. And we've said this over and over, but enough already. The time is now. Peer run orgs are uniting. People in the recovery movement, in the MAD movement, are uniting. We are going to work to collect community input on things like Care Court, SB 43, Prop 1, right? The community is rising above. So we thank you in advance for reading through the feedback that will be coming your way, because it is important that community is not only included in stakeholder feedback for the building of Prop 1, but we're literally leading it. And since unfortunately the county mental health systems haven't always used our input appropriately, we've just reached a time where we're taking matters into our own hands and we're building out those public forums. I know that our comms team is going to put an info at calvoices.org to, because Cal Voices is going to gather some of that feedback. I personally work in the investigations unit, so I may not be able to host many more of these community conversations, but I am just so excited to pass the baton to my colleagues at DRC who work within the mental health practice group, who work in legislation, right? Who work in different areas that could keep these conversations going, bringing this information to the community, every step of the way so that we end our year strong with solid feedback in any program that has to do with the treatment of our care. And shout out to the Californians against Prop 1 who fought a clean and fair fight. As far as I'm concerned, Prop 1 failed because even though they won by a very small margin. So Californians have spoken. We did not overly fund a fight against Prop 1, and I'm glad that we didn't because what we saw is the community speaking. The people of California have spoken. In my opinion, Prop 1 what is proof of that. So shout out to all those who worked on that. Shout out to all the people with All People's Health Collective who are working on putting out information. Shout out to PAR, peers advocating for recovery, the rights in recovery, and apologies if I've left anyone out. So Susan, I'm sorry, we just get so pumped, right? But it's real. But so we are concerned about the implementation of Care Court SB 43 and Prop 1. Next slide, please. Will you share a little, will you share a little on the recommendations that you've shared that are on this slide?
I just want to echo your congrats to the team that fought against Prop 1. I mean, I just think it was really, really historical. And even though that fight was lost by such a slim margin, I think it's really important to point out the fact that it was the community coming together and that we were the underdog. And it was really a David and Goliath. The governor and his team spent tens of millions of dollars trying to pass this, snuck it in during the midterm, cobbled it all together, and it never got any kind of pushback from anybody in the state legislature, except maybe a couple of Republicans. Not one Democrat would even question the bond or SB 326. It was just incredible to me. It was just AB 326. No, it was SB 326. Now I can't remember anymore because it all ended up as Prop 1. But anyhow, correct me if I'm wrong. But I just want to say that was really such an inspirational process, and that those in the community should feel very strongly protected by folks because we care. And it was an excellent, excellent grassroots, fight. And that's what it's all about. So we really underestimate the power of our community, and why we are really here today to say, let's do this. Let's make things different. Let's really take the bull by the horns and start standing up for ourselves, coming together and finding common ways to do that. I know we have the grant, this client stakeholder grant this year that was formerly operated by CamPro. And they did a wonderful job as well. And now we have that grant, and we will be convening listening sessions and public facing events. We'll be doing a lot of in-person events for that. So we look forward to meeting folks out there in the community. We look forward to continuing to sort of elevate our voices and lift up the things that matter most to us. But we need your help to do that. And so we really, really, really want you to know that we care and that we are here for you, and we want to hear your concerns.
Thank you, Susan, and thank you for
And I
your
probably didn't
commitment.
talk about all of those
But it's
recommendations.
okay. But like as you say that, like Susan, I thank you for being a trusted member of the recovery community. And I trust that with the feedback that you receive through these statewide community conversations that you're hosting, either in person or virtual, I know that like when you're in LA, I know you're going to reach out to Share. I know that you're going to utilize your community center. I know you're going to be at Painted Brains Community Center. I know you're going to be where the people are, right? So I thank you for not only hosting in such a robust way, but for ensuring that our state and federal partners receive that feedback directly, right? Folks from coast to coast should know what was gathered and what we mean, because when we only go to county mental health to give our thoughts, oftentimes they take the information and they word their own ideas using our language, so it becomes very confusing, or orgs start fighting over who got the contract and who didn't. And this is about building people power now, because health should never be this political conversation. And also, we saw that the Democrats all voted yes for all these coercive practices. It was
Question
the Republicans, of all people, they were the ones who challenged it. And I say that because this whole two-party system in California has proven to be completely inequipped. And sometimes when we're just so stuck on voting blue, we miss the opportunities to stand up against these government officials, elected officials, who overlook key points like allowing the community to host public forums, right? They forget to strengthen protection and advocacy for those subject to involuntary commitment, right? They turn
And I
yeah.
encourage the state, the folks that are listening today, if we do have them here today. I know that Corinne and Stephanie were going to try to log in, and maybe Paula as well. And if you're here, thank you for being here. We love that you're here. But I would just say, I haven't heard much about how they're going to implement Prop 1, and if there's going to be any stakeholder involvement in that. And I just really caution you to not implement this law without community involvement. We have got to be at the table, and we've got to be talking about these things, because what we have now is broken. And it wasn't broken by MHSA. It's been broken by these recent policies. It's absolute horrible what's happening to our people. And we are really in a civil rights crisis here in California. When we're holding people in locked facilities that don't have any criteria of being there, we're doing this day in and day out. I mean, what in the world are we doing? And there should be more lawsuits, and there should be, like, people should be up in arms about this. It's not even really in the press. Like, nobody seems
By
to.
design, Susan. But yeah, by design. And today we're working to shift the narrative, because the civil rights piece is definitely, I think more people would agree that while people are in these locked facilities, it's very apparent to see how civil rights are broken. And for people that say, man, DRC just continues to focus on civil rights, look, there's people that are living outdoors, unclothed, on drugs, suffering. This is not about their civil rights. To that, we say, okay, then focus on what's happening. Read our reports on what's happening in these locked settings.
Right.
Let's work to come up with solutions. And when you see the people who are suffering on the streets, please understand that tax dollars have failed to meet the needs of people because of the levels and the layers of bureaucracy that these government systems have to go through.
But not to mention, Vanessa, that the people that are being locked, I mean, in LA alone, if you look at the DRC report, you see that 35 to 40% of these people, even though Black people are only 5% of the population in LA, 35 to 40% of the people that are being held are Black. Now, this is just rampant racism and civil rights violations, and violating the US Constitution. Like, who gets held in America in a jail without any charges?
One is about the banishment.
Been
This
there
is
for more than
about
a year.
so
More than
this is yeah, so this is about the banishment of disabled people, because when you force people on medications without checking what that's like for them, right? Their life expectancy actually decreases by more than 30%, which is a crime, right? This is criminal. Only relying on the most intense psychiatric medications as a solution without focusing on the 8 dimensions of health, right? Where are these people working? Where are they living, right? The social determinants of health
And where did
that
hope?
are uplifted. Yeah, that are uplifted, which brings us to, we do have about 20 minutes left. Let's go to the next slide, and let's talk a little bit about the Olmstead decision and how long stays in psychiatric hospitals are resulting because of the lack of housing, and how it perpetuates uh, unnecessarily being stuck in locked settings. And if we could go to the next slide so Susan could talk about the recommendations.
On a comment that I think Angela in the chat made. And she said that I think homelessness is being used to marginalize and criminalize people. And I couldn't agree more. This is extreme poverty, and it should be reframed as extreme poverty. I think that we need to be looking at those social drivers of health, right? Looking at communities, looking at the poverty, looking at the economic instability. That is what's causing people to fall into to being unhoused. And we want to keep blaming, right? And the thing is, what have we learned in the recovery movement? What have we learned? That it's not about blame and shame, right? We've had to overcome those things. We've had to stop blaming other people for our problems, and we've had to look at our problems without shame in order to get better. And now the government is shaming us even more by saying we need to be off the street because we're mentally ill and we're drug addicts, and let's lock them away. It doesn't matter if you give them any charges, keep them in the jail for over a year. I mean, it's just absolutely preposterous this is happening in a place like California, and that people are losing years of their lives. What do we know about mental health clients to begin with? We know we die 10 to 20 years earlier because of our lack of care that we've received, because of some of the medications that we take, all of these things. And now, not only are we going to be dying sooner, but we're going to spend years of our lives in institutions.
But not if we have anything to do with it. Because guess
There's
what?
the humanity in
Because
it.
we're fucking eating our Wheaties, we're fucking eating spinach, we're getting our sleep,
On the right path.
we're
That's
healing
taken a
through
while.
alternative healing things, right? We're singing, we're coloring, we're dancing, we're
Yes.
recovering. We are recovering the way that people with psychiatric disabilities recover. We do not recover in jails. We do not recover in jails. That's how you may control us. But guess what? That's not where we recover. And we recover in community. And Susan, regarding the recommendations on Olmsted, will you talk a little bit about what's on the slide?
Yeah, I mean, the Olmstead Act really tells us that you can't keep people in institutions if they can live successfully in the community. And that's what we know that people can if we give them the opportunity. And so across California, we're violating Olmstead because we're keeping people in long term stays in psychiatric institutions for lack of a placement, an appropriate placement. These are some of the words that are used. But if a doctor says that people can be released, they should be released. We don't need to find new places to treat them. We don't necessarily. I mean, I'm not saying that people don't need step down and they don't need supportive housing and they don't need other kinds of supports in the community. But what I am saying is that you don't hold people longer than they need to be. I mean, this is a really very paternalistic system that is taking away people's rights in the face of benevolence by saying that it's benevolent, that we care for these people because they can't care for themselves. Look at them, they're sleeping on the streets without looking at poverty, without looking at trauma, without looking at, domestic violence, without
Government
looking at
theft. Let's call
institutional
it
racism.
out. No, let's call it, yeah, yeah, all that, and also government theft. Government theft. Like if they were private businesses, if these were the results with the billions of dollars that they have mishandled, everyone would be fired. It would be fired. But there's very little accountability, right? So let's look into these county mental health
I mean, I don't
systems.
even think people really know their rights, oftentimes in these settings. And we do have patients' rights advocates, but as many of you know, that's very disparate across the state of California. In some places that are more wealthier counties, like Santa Clara, have actual attorneys that do PRA work. But most of the counties do not have attorneys doing PRA work. It's peers that are, doing really good work around PRA, but there's not enough of them. It's not robust enough. And so we really need a movement of educating folks on their rights, that you don't need to be in these places. They can't keep you there any longer. But, they're
Yeah,
being.
and I think also, asking the state to stop with these planning counts, all like allow the
Let's teach
people,
people what
like,
Olmstead is. I tell people in these institutions, you're violating the Olmstead Act. They go, what? Huh? What are you talking about?
right. But I
Like,
think
nobody ever told them what it
if the
is.
money, if we start to request that some of these funds, rather than the state be the ones holding these planning council meetings, no shade on the planning council, but it's always going to be run through a government lens. But if some of that work could be done in community by community, so we then eliminate those layers of input that literally go nowhere oftentimes, or the amount of part that does get absorbed keeps government in too much of power, where they're the ones to read through the stakeholder input and they go, yeah, well, we could do that, but not here. Come on now, look, they're getting out of the hand. They're saying they want fruits and vegetables. Come on, no, dude, what are you talking about? You get, like it gets too wonky. It gets too wonky. But let's move to the next slide so we could, because we're on unlimited time. We're on limited
To know
time.
whether it's hats off to DRC for doing all of this investigative research and everything, but we need to know all the data. We need to know how many people are in all of these places around California, and we need someone to start suing the government for doing this thing to us. And so I just really, really hope that that happens. It's like these reports are great, but even after that report, people are still sitting in these places, and these are people's lives.
And
People
thank you for saying that, Susan.
matter.
Yeah, because hopefully, I think it'd be really wonderful for you to connect with some of DRC is very large, but if you could connect with some of the folks, working in the different practice group, like the mental health practice groups, or, working with the ledge unit, and people start to really get very specific on, okay, these amazing reports have been released. Now how do we mobilize community? Because I could totally see you and maybe like Leslie Napper of the mental health practice group, who's an amazing advocate, host maybe a community conversation on the Alameda a case, right, on maybe the Stuck
Yeah,
report,
and it's not just the hospitals, it's happening in all the jails
oh, for
who do
sure.
provide behavioral health services. And then, I know that like MAT treatment in the jails is supposed to be available to people, and that's medicated assisted treatment for folks that maybe have an opioid use disorder. That can be a really, kind of a beneficial help to help them get off or stop using. Some people stay on that medicine for a long period of time, which can be their choice, but sometimes the system gets them very dependent on it. But I guess my point is that most prisons and jails are not providing that services.
Well, and
And
I
people go in
know.
there with opioid addictions. Sometimes they're overdosing because they still have the medicine, in their pocket or something like that. But then also times they are really cold turkey detoxing. I just know so many people who have gone through that in the jails and in the prisons. And you think to yourself, how do we let this happen? This is not
We just
humane.
revived someone. My 14-year-old daughter and I were driving back from downtown LA. We were getting a few items from Santee Alley. We're driving back by MacArthur Park, and I stop the car. I see this guy. I pull out the Narcan. The local community helped, and in community, this person was able to be revived. He was blue when we stopped the car. Let me tell you, to see him wake up, the color reach his skin again. He opens his eyes, a young kid, blue eyes, blue, just beautiful human being that could have just died. And it's like, come
Were
on
you able
now.
to administer Narcan?
Yeah, we administered 3 doses of Narcan, and then he woke up. It wasn't pretty,
No,
but shout
I
out who
did.
responded. And this is where mutual aid and the investing in mutual aid, and no, not government mutual aid, like,
Yeah.
enough. It's
Well, and I
mutual
think
aid groups that are formed by people who understand their community's needs, and they know what their community needs to live, right, but
and
without transparent stakeholder involvement, and without the government releasing the funds, we continue to then create, oh, now we need another council, now we're gonna do that. No, we don't. Let's stop being innovative. Everyone wants to be so fucking innovative. Let's not be innovative. Let's fund what works. And you know what works? Community works, right?
and
Let's
peer
look
support,
into,
and
and
peer
let's,
support,
yeah.
which is
So
continues to be on the back burner in California, if you ask me. But I do think that we just have so many people that are hurting out there. And what do we need to ask ourselves, not how to get them off the street, but how to make their lives better. How do we make people's lives so that they don't want to use drugs? How do we build a strong and resilient community so that people don't feel the need to escape from their reality because of abuse or trauma or any of the other things that sometimes will cause us to use substances? Let's face it, right? When you have been sexually assaulted, when you have been abused, when you have been traumatized, that is typically oftentimes what we go to. And it's not a moral thing, it is just a reality of it. But when we're not treating people humanely that suffer from these kind of things, what are we doing? We're saying that they have character defects. They're saying we're basically saying that
Right.
you're
And this really brings me, Susan, to, a question that we have in the private chat is, how can we get support? How can we get support for us parents with our children in school, especially those our kiddos, especially those maybe whose our kiddos are on the spectrum being verbally abused. And this is also, so a few call to actions are: one, contact info at Cal Voices for feedback on this conversation and on others that you want to have. Contact Cal Voices for to be included in the development of the community input sessions on Prop 1 implementation, right? And I'm sure that when in LA, Susan, I'm sure you'll do stuff with Share, Paint Brain, the rest of the folks out in Los Angeles, but then also a call to action is, let's rise, let's have a focus on a cross disability movement, because I live with different invisible disabilities, and I know that me being on the spectrum wasn't always even identified. I've learned later in life, because as a brown person, a LA drug war survivor, they met my conditions with handcuffs. So autism, being neurodivergent, all these terms oftentimes do not truly make it in an down to the communities in an equitable way. People that look a certain way oftentimes are just like, you're criminal. So I think for the question in the chat, you could reach out to me, because I'd like to connect you with Sabrina Epstein and Vivian Hahn and others at our IDD practice group, who may be doing community work to uplift um, people within the IDD community. And I know that much of their work does interface with parents. And let's just build awareness to that, to the person who put that on the Instagram chat. Again, please reach out, because I'd like to have robust conversation with you offline and connect you to some of the team members at DRC that work in that area. And as a call to action, let's rise up and let's work towards a cross disability movement, because even within the disability communities, oftentimes people with certain disabilities are pinned against others, people with other disabilities, and it comes down to funding, because we live in a scarcity model, which is a sham. That's a lie. As much money as they're taking out of everyone's taxes, it's false. Like, we need to band together. And then we have another question that says, how do we fund pure respite? How do we market mental health to private donors? And you know what? That's a great question. I think that would be a really wonderful follow-up conversation, and I'll tell you why. Because of the co-optation of language. In Hollywood, I just learned that they're going to open up a pure respite. But when we look at who's running the pure respite and we start seeing clinicians, we know that's not a pure respite. That is not a pure respite. I know that in Los Angeles, we have 2 pure respites. That's not nearly enough. But before we start funding more pure respites, let's have true community dialogue on what the fuck a pure respite is and what it's not, and then work to fund those, and bring in the private donors and have a different conversation. But I think first things
But I think
first,
if the state of California can pay 24 billion for housing that never came to fruition, it could spend some money
do
on
it. Yeah. So maybe that, maybe through the
really,
Prop
really
One
need to.
conversations.
Yeah, I mean, we were fortunate to be able to establish some peer respites in California with Mental Health Services Act dollars. But now that Prop 1 has passed, this is going to be a threat to us as well to continue to keep them in business, let alone to expand. But I think these are the conversations that we need to be having with our state partners. Yeah, you think that housing is the answer to everything, but we don't see any housing really coming to fruition.
And the
And
types of housing, right? Because some of these housing, they say it's housing first. That's not housing first. There's a whole laundry list. You
right,
can't have your friends over, which,
yeah.
you can't do this. You can't do this. So
Yeah,
what if
like,
I
why
went
don't
to your
people
house?
take a shelter or some of these
Girl,
places because the rules, because they can't take their dog, because they
the
can't have a
shelter,
business.
they
Yeah,
say in the Inside Safe scam, they're saying, oh, we've housed all these people. But when you look into it, they're talking about temporary shelters. They're calling housing, you're gonna come and we're gonna house you, you're gonna leave by this time, you gotta leave at 8 in the morning, you gotta stand in line at
all
4:30,
all of it.
right? You can't have your friends, you can't have your pets, right? So what if I came to your house, and I'm sorry I'm being inappropriate, I don't mean to be inappropriate, but what if I came to someone's house and I said, no, you can't have sex, you can't eat
Yeah,
that, you can't cook, you can't do that. You're gonna go, man, that's not in my house. So stop calling things housing that are not a home. Let's put people in true homes and let's have follow-up discussions to our state, like Susan said, to our state partners. Let's continue these conversations on how we can help you release some of the power and share it with the community so that we can build a California, right? That we live in a beautiful state.
hey, how about we just give the money to the people? Because
How
I'm
about
pretty sure
that?
if we gave 24 billion to our people, they would find houses
If you gave peer run org to it would be all, we would have the
on
best
fire
communities. But guess
and
what would
light the
happen?
place on
It
fire.
would be, look, but that shit would be so fucking cool that everyone and their moms would want to go take over our little communities. Watch, right? Because we have fun. I'm so sorry that we didn't get through all the slides. We
I
need
did
to
want to
be
mention
with,
one thing that
yeah,
somebody said about the rural communities, and it's really
for
right,
sure.
Deborah, that there aren't peer respites in the rural communities. In fact, the rural communities have really lagged behind on a lot of the things that we've been able to do in the bigger cities with MHSA dollars and creating peer respites and peer run programs. Most of our rural communities have really only one or two peers working in them. And so, and they're really undersourced. They don't have a lot of mental health services. So, uh, you know, creating this robust system of peer support workers really could go a long way from that for this. Creating a statewide benefit for Medi-Cal peer support specialists. That's something we really, really truly think has been left out of the CalAIM system. And, any Medi-Cal beneficiary should be able to get peer support, and that's not what is happening in our system. But
And
there's a
peer
lot of things
support
we can keep
actually has
talking about.
guidelines. Yeah, and
Yes.
I
Yeah.
just want to plug that when we say peer support, we're not talking about the co-opted word peer that the government is now using. Those aren't the peers we're talking about. We're talking about peer support, right? It says ethical guidelines. Peer support is voluntary, meaning people should never be assigned mandatory to peer support workers. Peer supporters are hopeful. That's right, hope. We have so much hope, right? Peer supporters are open-minded. We are empathetic, we are respectful. We facilitate change. We are honest and direct. Peer support is mutual and reciprocal. We share power equally. We're strength focused. Peer support is transparent. Peer support is person driven. And as we close, I just want to know that, man, we can and do recover. We can and do recover. What works for our community has not been appropriately funded. Oftentimes, what government is funding is what works for them. It's not what works for us. So let's work together to free our people, right? Let's tell our stories as we need to, when we need to, and let's create robust community stakeholder input sessions, not where we go to them, but where we host and then we send them what we want them funded. Enough already. Enough already. But lots of love to everyone. I love
Lots
you
of
so
love,
much.
everyone. Thank you so
Love,
much, Vanessa and
love
DRC.
you. Love you.
Love you
Okay.
all. God
Bye.
bless.